In Good Shape, your health magazine on DW, featuring an interview with a different expert every week.
With me in the studio now is Dr. Gerhard Sattler, founder and medical director of the Rosenpark Clinic in Darmstadt. Welcome to the show, Dr. Sattler. Hi.
Hello.
We just saw some of the latest trends in cosmetic surgery. So what's on highest demand in your clinic?
Well, there's multiple things which are high in demand. There are patients with the need for body work, like liposuction or getting a new waistline, and other patients are focusing on the face. So it's a clear, distinct separation of groups, which then, after a little while, will cross over.
And did it change over the last years?
Oh, tremendously, yes. Since the public awareness and the media are focusing more the kind of importance of aesthetic appearance, there's a different understanding. And as methods have developed over time, things have been more predictable and more safe, and we have learned a lot.
So if you would take a look at my face, you would see there are some wrinkles I'm not really proud of here on my forehead and so on. So there are different things you could do to me. One is Botox and one is hyaluronic acid, for example. So what's the difference between the two procedures?
Well, number one, I think you're very attractive. Thank you. So there's not really something predominant I would think to do. But if you ask me now, about botulinum toxin and fillers, there's a distinct separation. Again, botulinum toxin you will do in the upper forehead and the upper third of the face, and fillers are more placed in the lower third or in the mid-face. So for every dynamic movement of the forehead, botulinum toxin is the right treatment. And so you can actually provide a better charisma for a patient. Also, you have a chemical brow lift, and so the eyebrow raises due to a new balance of muscle activity. Agonists and antagonists are in a new relationship, so as a result, you will raise your eyebrows.
And the eyes would appear bigger.
You will look more fresh, more aware, more interested in your friend, you know, so
yeah, right.
it's just a warmer and more elegant appearance. And also when you're stressed by the light, stressed by an argument of your opponent, you don't frown anymore. So you're cool.
And what about this volume therapy everybody's talking about right now?
This is now hyaluronic acid. And in former times, we have injected hyaluronic acid just under the skin. We actually filled the wrinkles, but not so anymore. Since quite a long time now, 6 to 8 years, we are injecting more deep into the deeper layers of the soft tissue flap of the face, and by actually injecting onto the bone, we can correct with little amounts of hyaluronic acid tremendous surface irregularity.
Dr. Sattler, boob jobs are one of the most common cosmetic surgeries performed. What are the options?
Well, there are so many different approaches to refine the breast, since the breast is, number one, mostly asymmetric, and the deformations can be so different. So you have to evaluate the skin, you have to evaluate the proportion and the asymmetry, and also then the connective tissue, what gives actually the shape to the breast. So if you need an implant or just reposition and reduce the skin, needs to be diagnosed by a highly trained specialist with a lot of experience. And this is what I would advise. If anything is in kind of a future interest of the viewers of this program, then I would really suggest to look in the internet for a good, well-known breast surgeon and get consultation.
So this is one of the keys if I'm looking for a cosmetic surgeon anyway. So I have to talk to many different surgeons, or what should I do?
Well, you cannot travel throughout the whole world,
Right.
and a big name is not always the right physician for you. So number one, I would get information through via the internet, and then I really advise to really visit the one and only who I will trust in the future, and only if my guts will tell me that this is the right situation I'm getting in, then I can believe in it and trust in it. So it sounds a bit stupid, but there's more truth in it than you believe in the beginning. And then of course you need to check the results and ask the questions, and then you make a decision if you want or not. There's one thing I want to say: in aesthetics, the patient actually sets the indication. What it means, if you have high blood pressure, then the doctor will tell you, you take these pills, otherwise you will be very sick. In aesthetics, the doctor is my coach, and I will tell yes or no. So it's a totally different situation.
Totally different
approach. And the patient actually should be aware of this. So the patient is in the driver's seat, not the doctor.
Okay, good to know. Getting back to boob jobs.
Yes.
Are implants always a solution, or are there different kinds of methods you can do to enlarge the breasts?
Well, it always depends, because not every patient will want to have a big breast. And it's a matter of proportion. How is the body size, and how actually is the excess of the skin. Sometimes skin reduction and repositioning of the fat is enough volume, and you don't need an implant. But in a lot of cases, you need an implant, and then you need to know which kind of implant. And there's several kinds of coating which are then more adherent to the thorax, and so you will have a long-lasting good result. In others, they slip more. Then you have different profiles, like round-shaped and anatomically shaped. So a lot of differences you need to be aware of.
So you can even take fat from different parts of the body and retranslocate it into
even
the
that,
breast?
it's possible, but you have to be aware that when you transplant fat, there's always a problem that the take of the fat in that new position is not always 100%. And then there's little scars which can be identified as might be a problem in a mammogram. And so you get confused if you want to see a...
Yeah, so the gynecologist could have problems afterwards finding out if you've got skin cancer. Dr. Sattler, thank you so much for being with us in the program today. Thank you.